Welcome to Medical Moron. I am your host, Ray Hanoski. Turns out you need your gallbladder out. Doctor says gotta go. Well, you're in luck. That's what we're talking about today here on Medical Moron. We'll be right back. Surgery. We will focus on the laparoscopic since it's by far the most common of the surgeries. With this knowledge, you know that open gallbladder surgery used to be the norm just 30 years ago. And maybe the route your doctor suggests or reverts to intra-procedurally. It amounts to 4 to 6 inch scar just below the ribs on the right hand side. Laparoscopic is usually 4, maybe 5, sometimes 3 1 centimeter incisions or scars, barely discernible from natural skin. Very small scars, and that's why people generally go to this as well. It's safer procedure these days. Okay, let's check you in. Let the perioperative nurse talk. They will ask you questions. They're going to ask you things such as, where's your pain? Do you have any dentures? Do you have any hearing aids? Things that need to be taken off or removed, such as rings and earrings, before you go into the OR room. This keeps you safe since they use electric cautery. The anesthesia will talk to you. They're going to ask you questions more related to medications and your history. They will bring you into the OR. They'll introduce you to the team. They will anesthetize, prep, drape, hook you up, and size. Where's my anatomical model? Come on in here, Ira. Ira is going to be our guinea pig for this here. And what I want to do is show you the approximation of how this works. Okay, so her rib cage comes down here like this. You can kind of feel it kind of comes like this. What it does is it protects the liver. Yeah, she falls off her bike, hits herself here. It's not going to injure the liver, which is very vascular and can bleed easily. So it's something that you don't want to injure. Underneath the gallbladder, kind of tucked under here. Well, let's make a mark here. Okay, so gallbladder is kind of like this. I'm sorry, the liver is kind of like this. And just the gallbladder in a little bag, bigger on some people, smaller on others, is right there. I'm going to move over just a little bit like that. Now, with the gallbladder, there's a lot of arteries, ducts attached, and the physician, of course, the surgeon knows exactly where to go when he takes care of these things. So he's going to look for a xiphoid process right there. He's going to make an incision about here, just above the belly button, maybe where this is. Just going to find out where the rib is and make another incision there. And there, some surgeons will do 5 incisions, come from this perspective. Some will do 3. It depends on who's doing it. And they each have their own technique. They're all experts. I've seen it all, okay? I've been there and I've seen them all. So through these here incisions, they take what's called a trocar. This particular trocar, and there's many different companies that have these devices. They use this here and this, and they kind of combine the two, snap them together. This whole device it's not how they put it in, but typically it goes into this space right here. They push it in through, yeah, can't see, I'm looking on TV right here. Somewhere there into the incision site that I made, goes into the stomach, and then it sits out. This part sits above the anatomy. Okay, they put their instrumentation in through this, through that, and they're able to manipulate it around till they find what they need. They can do some excising and take the gallbladder out eventually. Comes out. They will sew these places up, sew them up, sew them up. You don't even know you had surgery. Surgery looks like it's invisible. If you look carefully, after a few years, you have a difficulty even finding those little incisions. The typical instruments used, long grapplers and graspers, long, like this long, depending upon your weight, they sometimes use longer because there's a lot of tissue to go through. The bigger you are, of course, the more tissue you go through. These graspers all the way through the tissue into your intra-abdominal cavity, which they have insufflated with some CO2. The pressure of the belly is closely monitored to prevent over-insufflation with CO2. CO2 pressure can be dialed up or down accordingly to a surgeon preference and for the safety of the patient. You're always number one in the mind of the team. When the gallbladder is finally removed from its bed, the space is double checked for bleeders and irrigated. Using a grasping force and often a plastic bag, they put the gallbladder into the bag and they pull the bag out through the little tiny incision. The gallbladder is removed, taking care not to spill the contents. Local anesthetic is applied to counter postoperative pain. Incisions are sewn and small bandages are applied. Then it's to the recovery. So you're transported from surgery table to the gurney and again to the PACU or post-anesthesia care unit. This is a highly skilled set of nurses, usually keep you in the care for 1 to 2 hours and then send you home. Unless you're a physician, and let's be honest, your insurance allows an overnight stay. It may be deemed necessary, most times not. Post-op instructions include this spiel. Expect soreness and pain in the right shoulder. So on the right side, shoulder and back, it's gone 2 or 3 days, sometimes just a day, sometimes not even there. This is often the dissipation of the CO2. Expect bruising. Most pain decreases with time. Expect a healing period. Pain should lessen and not increase post-procedure. Restrictions include lifting activities and lifting to the physician's discretion. Watch for temperature increase. You do not want a temperature increase, and increasing of pain or drainage at sites is not good. Your doctor immediately needs to know of these. It could become an issue and it's indicative of an infection. I am not an MD. I'm an RN. But I've seen it all in my 30 years and I'm not hesitant to tell you what's up. If you have any questions or surgery you want covered, please comment and let me know. Please subscribe and like, as this will substantially assist the progression of this channel. Take care. Thank you very much. I appreciate you folks watching.